All right, this is my daughter, and she's going to help me open things up.
Hey guys.
You ready? Ready? Let's talk about sex, baby. Let's talk about you and me. Let's talk about all the good things and the bad things that may be. Let's talk about sex. That is. That's all I'm here for. Well, that into. Wait,
Carry her laptop.
can you guys hear me? I have to see. Is the mic working, or do I need to use this one?
I think you might need to use the hand.
That's not projecting, it's just recording. But don't move it, please. Thank you.
Okay. Where do we begin? Well, first, I've done this talk many, many times representing, I attended a conference and I was so captivated by it, and it was put on by Baylor, Scott and White, sexually transmitted diseases. And it covers a wealth of information. Let's see if this stuff works. Oh. Right. See, I may have to fix it. All right. So, do we all know what sexually transmitted diseases are? What the big ones are? Or the difference between sexually transmitted infections? There are bacteria, protozoa, and viruses that will cause the diseases, that will give you the infections. The infections then can have long-term consequences. I didn't want to talk about just the things that we already know. And forgive my slides. Because they're pretty basic. I really want you to pay attention to what I'm saying. And then we're going to open this up for discussion. Because these, anybody has their parents here? Are their parents? Anybody's parents? Okay. All right. Well, she may not participate in front of you the way that others can anonymously do. So I'm not going to even ask, oh, whose parent went to East St. John between 1980, when we were the undefeated champions at football, through 83 because, or 85.
That's right.
Because I may know your parents, so we're going to try to keep this anonymous.
I don't know you.
Oh, okay. How common? Well, at one point in 2018, in the United States, 1 in 5 persons had a sexually transmitted infection at any given time.
Wow.
1 in 5. How many people are in this room? If you want to do it kind of that way. Oh, yeah. You know? Every 5th person. That's the same number of people that carry herpes simplex virus, type 2, commonly known as genital herpes. Some people will have an infection like herpes and have no idea that they have it. And then that's why it got its name called the gift that keeps on giving. Let me catch up with my slides, because just forgive me 1 second. I'm trying to go. Most adolescents, let me rephrase that. The demographic, the population of people who carry the most sexually transmitted infections are ages 15 to 24, okay? Why is that? That's considered adolescence. Well, because they're having sex more indiscriminately, or let's see, what would you call it? Hooking up? I don't know, bumping a night? Something to that. And as women have found...
Call them sneaky links.
Oh, see, I just learned something today. Sneaky links. Well, so as women have, and young women have developed or, found their voice and found their independence and the agency to say, oh, I can have sex if I want to, when I want to, with whom I want to. It's gotten, there has been a significant change I've seen over the years, so that women are empowered to have sex just for the pleasure of it themselves, without the consequences, without the stigma that used to be associated with it. I don't think you all are gossiping or on Snapchat or whatever it is now, talking about who had sex. Oh, she had sex. You know what that means? That's why I started this. You cannot talk about sexually transmitted diseases without talking about having sex. But at any rate, the highest incident is between ages 15 and 24. All right, and believe it or not, it affects different groups differently. So while everyone can be transmitting these infections and getting them, there's a healthcare disparity. I don't know if y'all heard about that or read about it. Hopefully you heard about it today. So that means that everyone is not treated the same. When I was doing my training, literally, if there was a person of color and they came in with pelvic pain or a discharge, they got treated as if they had pelvic inflammatory disease, most commonly caused by gonorrhea, chlamydia, as the main two culprits. So they got diagnosed with it and treated, or sent home with it. And if it were not a person of color, oh, she probably has endometriosis, right, which is not sexually transmitted. So there's that stigma, and some of that has carried on even to today, because there's still doctors who were trained when I was trained, and they're still carrying that over some of the misinformation or miseducation that was received. So it is important now that young women do have that agency, they do have that voice, that they are able to speak up for themselves and ask the pertinent questions, like, who you been with? When I have a session with a new patient, new GYN who may be coming in for contraceptive counseling, one of the questions on the history is, how many sexual partners have you had in a lifetime? And some people will just they misread that for some reason. One. And I said, oh, so you've only had sex with one person your entire life. Oh, no. That's my current, I'm only having sex with one person right now. Right? So again, that gets to us about the risk factors. So you know that it's affecting us differently. It affects the people who are having more sex with more people, right? And it's getting diagnosed differently at different rates. So, like I said, with the example of herpes, many people have it, don't know they have it. And when I have a pregnant patient, I have a captive audience, so then I'll draw certain blood work. And one of them is to see if they've been exposed to herpes, because unless they have an obvious sore on their genitalia or something else, they may not know. My staff would get so angry with me because, why are you doing this? These people are getting upset. Well, when I have the discussion with them, the discussion says, do you know that 1 in 5 people have herpes? And most of them don't know it. Like, you didn't know it until I told you today. And that's how it keeps getting perpetuated. It spreads because once upon a time, we thought you can only spread it if you were having an outbreak. That's the highest time that it can get spread, for example. But there's something called asymptomatic, meaning having no symptoms, transmission. So you can actually get a sexually transmitted disease like herpes type 2 by having intercourse and what's called outer course, which is very close contact, or in the LGBTQ community, for women, you can get sexually transmitted diseases from other women. Herpes is one of them, trichomonas is another. Now, obviously, this is more likely to occur with someone who may be more bisexual or fluid. The other high-risk group is males who have sex with other males. So, back to the asymptomatic, like herpes, or even HIV. People won't know they have HIV because often it is without any symptoms. So the key is to protect yourselves. We're not going to go through all of these. The key is to protect yourself. This is not an exaggeration. Once upon a time, HIV was a death sentence. Why is it that we're having a rise in casual sex or hooking up? Why are people not using condoms anymore? One of the main methods of prevention, well, the number one method is abstinence. And that's, there are many reasons to abstain. So that's just one of the ways to prevent sexually transmitted diseases. Condoms help, but it's not a guarantee. Because again, when I mentioned outer course, so anything that condom isn't covering and that can have like trichomonas, syphilis, if there's a sore outside, herpes, it can still be transmitted just by the contact. And we know that at once upon a time, that was a death sentence. Syphilis was too. Many people may be familiar with the Tuskegee experiment. Are you familiar with it? You've heard about it? Who hasn't heard about it? Seriously. So what happened, I'm gonna get my years wrong, but let's say in the early 20th century, these doctors were doing an experiment because they wanted to see what was the natural course of syphilis. So they had a bunch of, it was black men. It was all black men that signed up for it, and they were tested, and they were told they were being treated for this treatable disease if you catch it early enough. But again, they were curious about, between 1932 and 1972. My parents were born in 1932, and my younger brother, he was born in 73. And it affected nearly 400 African Americans. It didn't just affect the men who were in the studies because they weren't being treated. So they went home, they were having sex with their wives got pregnant, or maybe their wives were already pregnant, and then their babies were born with blindness, or they had stillborns. And for those that weren't treated, it progressed, it affects your nervous system, and once it is in your brain, you can die from syphilis, sexually transmitted disease. It can cause pain. That's one of the common symptoms that brings people to the emergency room. And when I mentioned earlier about it's pelvic inflammatory disease for people of color, it's endometriosis for those who are not. That pain can be chronic, long-lasting. That pain may not even be able to be treated. Pelvic pain it's a beast to deal with. And one of the other big problems it can lead to is infertility, or the difficulty to conceive. It can scar, chlamydia in particular, can scar and damage a woman's fallopian tubes within 5 days of contact with the bacteria before you ever have any symptoms. It could be all over with for your fallopian tubes. Not only that, The damage can be just enough that when you do conceive, the pregnancy implants inside the fallopian tube. That'll bring about pain. But the dangerous part, and what many women died of prior to being able to have ultrasounds and the technology to find it early enough, that tubal pregnancy would rupture, and because there's so much space in the abdomen and pelvis, many women would bleed to death. That led to the high mortality rates associated with being pregnant earlier on. They're still pretty high for women of color, but that's another topic altogether. And cancer, you all may be familiar with HPV, human papillomavirus. Merck Sharp and Dohme had come out with an HPV vaccine many years ago, before you all were born, to be honest. It was such a breakthrough because it was really the first vaccine that can prevent cancer. The natural course for human papillomavirus, well, certain viruses will cause those external genital warts, but certain of them will cause cervical cancer or cancer on the penis for the men, cervical cancer for women, and that is a miserable death. That's a cancer that can lead to death. But now there's a way to prevent that, and that's through the HPV vaccine. How do you know if somebody has HPV? Well, in women, most of the time, and in men as well, it's microscopic. You don't see it. But when you do see it, you know, my daughter said I should start with a joke, but I didn't think this was much of a joke. I had a patient who had a lot of external genital warts. She was pregnant. They got worse as the pregnancy went on, and we had to address it because it was going to affect the route of delivery, whether she could deliver vaginally or would she have to have a surgical delivery like a cesarean section. And I said, did your partner have anything that you saw, anything that kind of looked like this? She said, well, yes, he did. I said, you didn't ask him about it? She said, yeah, I did ask him about it. And I said, well, what did he say? Oh, he said that ran in his family. And I was like, it ran in his family? Yeah, no. If it's running in his family, you don't want to run with that pack. You thought it was funny? So I really can't tell where I am on the slides. I mentioned that already. It's easier to get HIV if you have any other inflammation in the vagina. And that actually includes yeast infections, bacterial vaginosis, which are not sexually transmitted, but it's much more, they all run together. You know, well, sometimes we'll be in the office and somebody comes in with a discharge and we'll look at it under the microscope. You can see the trichomonas, the live trichomonas. It looks, it's like, ooh. Then the cultures come back, or the pap smear comes back, because now we can do pap smear and gonorrhea chlamydia testing all with one swipe. Oh, they hit the trifecta. Gonorrhea, chlamydia, and trichomonas.
Oh, wow. 3?
Oh, they run together. They often are together. People don't necessarily come in with one sexually transmitted disease because they may not be symptomatic of it, right? So if they're not symptomatic of it, they don't think anything of it. And you know who's the least symptomatic? Men. Now, if they do have burning when they urinate, they may go see about that. But oftentimes they're asymptomatic, so they can keep spreading the love. And that's often what happens. It's when you don't have the symptoms. Again, it goes back to prevention. All right? It costs a lot of money. It costs a lot of money. Treating these infections and the subsequent consequences. Right? So, do you know how much it costs for people to have in vitro fertilization because maybe the tubes are ruined? One round can cost $20,000 to $25,000, and you have to pay before that appointment. You go in for an appointment, I don't know that they take regular checks. They may take a money order, cashier check, credit card. It's quite expensive. That's just one of the expenses. The testing adds to the expense. The medications add to the expense. And then when you go back for your test of cure, we used to call it test of cure. I'm showing my age. It's really a test of reinfection. Because if the partner isn't treated at the same time, and you continue to have a relationship with them, you'll get reinfected. So how do you have that talk? I mentioned these earlier as the different routes of how can they spread. How do you have that talk? How do you come up and how do you say to somebody, how do you ask the question? Well, the same way you decide you want to have sex, have that same resolve to protect yourself. Find out, hey, has your girlfriend ever had an abnormal pap? Because that means that person most likely had an abnormal pap smear because of HPV. Ask the question, have you ever been tested for HIV? Let me see those test results. Then we can start knocking boots. I know that was that. But you know the song, right? Right? Now, it seems like all the STDs that start with an H are viruses, and they're not curable. You can treat the symptoms, but you can't get rid of them. I know I said herpes a lot because I've seen it a lot. All right, so there's herpes, HIV, human papilloma virus. Hepatitis B is considered, well, it is sexually transmitted. Not that it's just considered sexually transmitted. It is. It can involve the entire female tract. Trichomonas will be in the vagina, often mistaken for a yeast infection because of the discharge and the intense itching. But there's usually an odor associated with it as well. So once yeast infection medicines became treatable over the counter, and patients would use it, well, I've used this medicine and it didn't go away, then they'll come in. And when I say patients, I'm referring to my patients, which are biologically female. They'll come in with a discharge, I'll take a look. Let's see if I can show you what the, am I supposed to point it?
Both ways, it's like,
Is it going backwards? All right. So it can affect the entire genital tract for women. There's the cervix. Ironically, it sort of looks like a circumcised penis. It's kind of the, well, never mind. So that's the test score for the pap smear. Now, another reason that adolescent females are more likely to get a sexually transmitted disease is because anatomically their cervix is different than an adult cervix. They have more of those, of certain cells exposed, and as you get older, they fold in. So they're exposed. Gonorrhea likes to live in there. Chlamydia likes to get in and travel way up to the tubes, quick, fast, and in a hurry. So that adds to, oh, you know what? Well, I gotta have the obligatory male picture as well. What doesn't seem fair is, for men, this is just what I've heard a lot of times. I'll tell a patient, hey, you have trichomonas. She tells her partner, you didn't get it from me. My doctor said I'm clean. He didn't find anything. Well, for a very long time, there was no way to physically detect trichomonas in a man. It would kill the protozoa in the process, and you could not stick a swab far enough to where they would reside. A man wouldn't tolerate it, and That's, right? So if the woman knows, I had a patient, she was married, every other year she would have trichomonas. And I said, your husband has to come in. He absolutely has to come in. She would get treated and be fine, and then the next year. So he came in very proudly. Well, no, not me, my doctor. I went to the urologist. He said, I'm good. I said, no, you were just good at being treated before you went to him. That's number one. But the reason I know it is you're not upset with your wife. Because if you don't have the STD, how did she get it? That should make you really upset that she came home with a sexually transmitted disease that you don't have. So what does that mean? And then he could not answer me, right? He wasn't my husband. I don't know why she could not have that talk with him, like, or confront him. I do know why. Part of it was denial on her part. That meant she would have had to take action of some sort. And that may be a hard thing to do. I don't know the dynamics of their relationship. And sexually transmitted diseases can be, it sometimes can go hand in hand with domestic violence. You know, I'm not gonna say this because it's being recorded, but there was a celebrity couple that I recall, he beat her, maybe threw her out of the limo, I'm not sure about that part. Well, the buzz amongst the GYN community was he was upset because she gave him a sexually transmitted infection. I mean, that's no excuse for what was done. But it can lead to that. But it may also be a way of controlling the partner. It's usually the men controlling the women, but these days it can go the other way. Forgot I could see. These days it can go the other way. These are things I've said. These are some of the reasons. Teens are at greater risk, multiple partners, high-risk partners. You know what's considered high risk, right? Not using the condoms, right? And those that are more prone to infection. So if you have some kind of medical condition that makes you more susceptible, then you'll probably get something. Like I said, here, everything with an H is a virus. You can get it. And actually, it's not correct anymore to say it's not curable. There's something called IVIG, intravenous immunoglobulins. And they can get rid of viruses. That's what helped the former president when he got COVID. IVIG. I'm not going to go through, I meant to, that's one of the cancers. Kaposi sarcoma is a skin cancer that you see in AIDS patients. And sometimes you wouldn't know that until the patient came in with the infection. That was back when we first learned about it. I have no earthly idea why sexually transmitted diseases are on the rise since we discovered what HIV was, because the campaign all over and everywhere for a very, very long time was to use condoms to help prevent the spread of HIV. That apparently did not work, because you would think everyone in your generation automatically condom would be associated with having sex. But that's not what happened. That is not what's happening. As we've made medical advances and made steps forward in keeping people from dying from AIDS and AIDS-related illnesses, we've taken a step backwards and got more relaxed. But I want to repeat it, abstinence. And even if you've started having sex, you can always stop. Get yourself together, figure out what you want to do, find your voice to be able to ask the questions and have that dialogue. And if that's somebody that's I need to take care of me because obviously you're not concerned enough about my welfare. Abstinence, condoms, vaccinations, like for HPV. Do I have the right one? I keep. I'll let her be. I can skip faster on my laptop.
That's the end of it.
No, it's not. I think I got shut down. Or I turned it off accidentally.
Yeah.
I went way past that. Numbers, stats. I used to hate looking at statistics. That's important. So some of these, there are 3 reportable sexually transmitted infections. Gonorrhea, chlamydia, and, oh no, I said that wrong. Syphilis, chlamydia, HIV. And you know the scary thing about gonorrhea, it should be reportable. Gonorrhea is the one that has developed resistance. It's a bacteria, and it has developed resistance so that we can't treat it simply with penicillin like it used to be. You have to hit it with an injection and something that you take by mouth because it is steadily evolving. Gonorrhea is here, it wants to get you. It wants to get you. I'm not going to show you a whole bunch of pictures, and I know my time is running short. I wanted to try to cover that, how to have that conversation. But from this point, I'm going to have you ask questions or give any scenarios that you would like answered. I remember one story. I remembered a patient who was pregnant. This was when I was in medical school, and she came in, a young Latin American female, that was the terminology at the time, big pregnant, very far along, and she had pneumocystis PCP, pneumocystis carinii pneumonia. So she came in with that. She was tested for HIV, she was positive. So her very first exposure to HIV or diagnosis, she was already with AIDS. This was before we had anything to keep her from spreading it to her baby. And she didn't understand it because she was a good girl until she got married. I mean, that's wrong. She was always a good girl. She said, I was a good girl. I did not have sex until I got married. I've only had sex with my husband. Okay, well, now we know where you got it from. People hearing the news about having a sexually transmitted disease, their reactions to it are even different based on your background. Sometimes it has been noticed that when you talk to certain people about it, it's like, yeah, okay, there's something I can take for that, right? And then, no big deal. Other people are horrified and want to kill somebody. Where would you stand on that? One of the first pamphlets I saw, I went to UCLA, so I was in Los Angeles, was chlamydia. No es una flor. Anybody speak Spanish? Chlamydia. It is not a flower. Doesn't it sound pretty though? Chlamydia. But it's not cute. It's not cute at all. What were those steps to prevention? What's number one? Abstinence. For a reason. I gave you a biological reason and emotionally. I know you guys think you're there, but actually things have changed. They've changed. Women have detached the emotion It used to be, and I know it's not, it's still that way for some folks, but not for all. They're okay with having casual sex, zero connection. That used to be a trait attributed to men. Oh, it didn't mean anything to me. It was just there, and they acted on their animal instincts, where we're supposed to have higher, capability of reasoning and such. But now women are doing the same thing. We're becoming equal, all right, but it's not helping us with regards to this.
What does your experience tell you about young girls and going to the doctor, to actually establish a relationship with an OBGYN? When is that best? Going from the pediatrics context to the OBGYN?
Okay. Typically, young ladies, unless they're having a problem with their periods or something, they don't really have to come for their first pap smear, which is screening for cervical cancer, until age 21. You need a pap smear at 21. Once you start becoming sexually active, you need to regularly go to be screened for sexually transmitted infections. Okay? If you're having a problem with your period, you go at that time. So I've had a multitude of young mothers, because they had gotten pregnant when they were very young, bringing their daughters in for me to talk to them, because they don't want what happened to them, the mother, to happen to the daughter. They want them to have more information and to be more prepared. And maybe if she hears it from you, well, no, really, that mom is the best person to have the most influence. Not with scare tactics, but just with honest, open discussion. My mom told me, when you have sex, you are gonna get pregnant. Not you might get pregnant, you're gonna get pregnant. Whew. Talk about, I did not want nobody's baby. I know that's grammatically incorrect, but I did not want to get pregnant. I had ambition. I wanted to go somewhere. I wanted to do something. And I wouldn't be able to do that if I had a baby. And my mother made that perfectly clear. So, one more thing. So there's a difference if you're not sexually active and you don't have anything going on with your periods, you see the pediatrician until 21. Some of them say it's time to go down, from the pediatrician. After that, then it's the gynecologist, but a primary care for other things. Young women have problems with their periods, then they're brought in at that time. Some go through precocious puberty. They need to be treated usually by an endocrinologist, not by a gynecologist, which means puberty comes on too early in life for them. Which means, yes, they can get pregnant, they may only be 7 years old. But it can also seal the growth plates, and there are other medical complications.
You made me think of another question. The first question I wanted to ask, does any of the viruses, if untreated, can turn into AIDS? That's my first question.
Only HIV. If you're infected with HIV, human immunodeficiency virus, the results of that, which is opportunistic infections or certain cancers, then it is called AIDS, acquired immunodeficiency syndrome. So only HIV can cause AIDS.
Okay, second question. We ladies just learned how important our WAP is. How important is it for we ladies to find a good OBGYN?
Oh, it's extremely important. All right, and just because it's wet doesn't always mean that's a good thing. Because it could be because of bacterial vaginosis. It could be because of trichomonas, which is usually, the bacterial vaginosis usually has an odor. So does trichomonas. So some people, oh my goodness, I usually have a better poker face when people bring things to me that you're supposed to keep closed, or any other euphemisms. It is what it is. Do y'all have any questions?
So someone with asymptomatic herpes, could they
any point have unprotected sex, or is that completely?
If they're most likely to transmit when they're having symptoms. So they're prodromal symptoms. You kind of feel the tingling or burning or an odd sensation because the herpes virus lives along a nerve tract. So it comes out in the same spot because it lives in this nerve root ganglion, and then when you have an outbreak, it usually comes in the same spot. And patients who are who have the lesions, the ulcers, they know what it feels like. So they either start getting on the medication, and usually they avoid having sex. That's what they're advised to do. So asymptomatic, well, it can be shed and spread. It's less likely, but it's still possible. So if that person knows they have herpes, the responsible thing to do is use a latex condom, always. The lambskin or any of the other types of condoms are too porous, the virus can pass through. And I think one of the slides showed, these are not just restricted to the vagina and the penis. You can get gonorrhea, you know, somebody thinks they have strep throat, and it's gonorrhea. Herpes type 2 it's called genital herpes because it prefers to live in the genitalia. But it can live in the mouth, the throat, your tonsils. You can also have chlamydia. Gonorrhea is more common. Gonorrhea can even infect a joint and cause an arthritis. And I actually did have a patient had a single, whenever somebody comes in with a single joint swelling, you have to test them for gonorrhea. Because that may be how it presents. It's kind of interesting. There's so much, I have way too many things that I can't touch on everything. I wanted to say repeatedly, prevent. Ask the questions. Protect yourself. So that's another way of protecting yourself. Ask the questions. Make the decision. Know that your decisions have consequences. If you're going to just say, oh, YOLO, yeah, you only live once, and it may be shortened by a sexually transmitted disease.
We are getting close to time. I do have, this is an important question.
You should have called me when the other person came up.
I know.
I could have done all my slides.
This is an important question. Insurance. Because don't you have to ask for a herpes test or an HIV test? It's not part of the...
I was going to say that. I'm glad you mentioned that. I'll have patients say, I was just tested for everything. Did anybody do blood work? So the testing for gonorrhea and chlamydia for women is a swab. And oftentimes it can be done with a pap smear. Testing for men is a swab in the penis, but there is also urine tests. They're not as accurate, and that's what we use in the pediatric population, you know, because we're not putting, you know, if they suspect that the child had been molested, but you can test it more accurately for men in the urine than for women. You really need to swab the cervix. But the others are blood tests. The viruses, not HPV, but HIV, herpes, hepatitis, those are blood, and syphilis, although syphilis is a bacteria, it's a blood test. So if you hadn't had blood work done, then you weren't tested for everything. You know, so, oh, I'm scared of needles. Well, you're going to have a lot of needles in your future.
As far as like insurance covering those tests, like how many tests do like a typical insurance cover?
Okay, as many times as you have it. Now, for preventive measures, people don't normally go in, well, when they go for their annual exam, say with the gynecologist, they'll get tested. If they think they may have been exposed, they get tested. There are specific codes the doctors use, and it'll be covered by the insurance.
What are your
Oh, there are facilities, you just have to find them, that do free testing. It used to be the next street from my house, and then they moved to Central.
Right.
And I think that's where it still is. So there's always, here in New Orleans, there's the Delgado Clinic. You know, one of my pet peeves were the patients coming back to me saying, my boyfriend said he was negative, or they told him he didn't have anything. Did they tell him that very day? Yes. I said, then he doesn't know.
Right.
Because the results haven't come back. Nobody's doing those tests at the time. Nobody was doing the testing in the office. It has to be sent out, and it'll come back. Even if it's blood work, you're not going to get the results the same day. So if he told you that day, then I find it hard to believe that a doctor's telling me, oh, you're negative, you know. And then I asked some doctors at work, oh, well, he didn't have any symptoms. Did he tell you he was exposed? So if she has it and they had sex, he was at least exposed and should be treated. We've changed things to the point that now it was considered a liability, but it's like, I'm gonna write a prescription for my patient, here's a prescription for your partner. As long as he's not allergic, he can get this filled, and he needs to take it at the same time that you do. Because the reality is, you can get trichomonas from a toilet seat, but who's sitting on something that's wet? It would have to be wet for it to still be alive. Ugh. Who would do that?
That's very
But if you don't have insurance, every city has a public health service or something that provides free STD screening. For here, it was No AIDS task force. They would test for HIV, hepatitis, and syphilis. So there are ways to do it. You have to be resourceful and see what's available. Yes?
You mentioned that non-latex condoms could be porous. Are they still safe to use for, say, someone with a latex?
Not for sexually transmitted diseases, not in preventing sexually transmitted diseases. That's why it's specified latex condoms. Because lambskin condoms, they are made from natural, so you can't control the size of the pores. It's made from lambskin. All right, and it will not prevent, it can be helpful for preventing pregnancy, but not for preventing sexually transmitted diseases. With that? There is another condom out.
You don't want to tell them.
It exists, but they're better now, but there are non-latex. I was specifically talking about natural condoms or those made from animal membrane. So there are condoms that are available that are not made with latex, but similar to the non-latex gloves, they just don't fit the same. Not quite, but things are getting much, much better. Yes?
So, would another substitute be the female condoms?
Well, those are usually latex.
Oh.
Those are usually latex. So, I mean, dental dams as well. You know what a dental dam is? Google it. Google it. Any questions, Celeste? My daughter would like to add something. I'm almost scared. Almost. Now, since they were very little, I'm a gynecologist, and I said, when people find out that their mom is a gynecologist, they maybe expect them to have the same knowledge that I do. So I wanted them to be prepared. So before they had their periods, I made sure they read the period book, and then I found my son reading it. I said, you don't have to hide to read it, Joshua. Read it, I want you to read it. You need to know this too.
And kind of piggybacking off of that, people also assume that because she got out, I would go to her for all of my, no. But what I would like to add is that earlier in this presentation, there was a question of like, why do STDs more commonly affect adolescents, like 15 to 24? And so I am a psychology major at Xavier University, and and I'm taking a human development class, and they were saying during the adolescent stages, which for females can start as early as 8 years old, there is, so let me start with this. So there, you know, as we all know, there are many parts of our brains, and I believe this part back here, the amygdala, I
The
believe.
amygdala is back there, yes.
Yeah. So that is fully formed by age 12, but your prefrontal cortex isn't.
The prefrontal is where you make your decisions.
Yeah, that is not right. That is not fully developed, and during puberty and adolescence is when it begins to thicken and develop, and your reasoning skills, your problem solving, and things like that. Like those are, it's thickening. It's still developing. You're learning, and adolescents are. And that is why adolescents are more prone to risk taking. Like we tend to want to do crazy things because.
It's not going to happen to me. That might happen to her, but it won't happen to me.
Right. And
I'm sorry.
but yeah, so more prone to risk taking because we're still so young. And it's like, while of course to us it's all relative to our age, like 5 years may seem like a very long time to us, but it's in retrospect, it is in the grand scheme of life, it is not very long. And everything is still new to us. Like we're still learning. Like everybody thinking that they know everything, you don't. Because there's
I'm going to throw it. Go ahead, Celeste.
but just it's keep making me lose my train of thought.
I'm so sorry, but I just found that very amusing. Y'all don't know everything. Okay.
But yes, it was like we're still learning and we want to experience all of these new things and you want to experiment. And this is a lot of the time, like late high school, early college, is the time that a lot of people do experiment sexually and just because you're learning about all these new things that you wouldn't have known as a child, as not necessarily should have, but just understand that we are still learning and also don't be so hard on yourself because if you think you're going through something, you're never going to be the only person going through that. There's always an entire community of people who are going through exactly what you're going through. And especially now with the internet, it's a lot easier to connect with those people so you don't feel so alone. So, and I know like things can really feel like the end of the world. Like I have a friend who recently got over chlamydia. She thought it was the end of the world. Like she was crying. She was ready to slash this dude's tires, nails in his cars, Jolly Rancher on the window, potato in the tailpipe. She was ready for it. It was over with. Pepper spray on the door handles. Like she was ready for it to be over with. But it cleared up in about 31 days. You know, it's well, until it's completely out of your system. Until it's completely.
So I guess what you're saying is you got, at that age, y'all very inquisitive.
Well, that's what happens. You know, if going to college, away from the parents, you're away. It's not the same as high school, even if you're living at home, going to college in the same city. But that's a time for experimentation, and they do. And oh my gosh, they have such cute boys from Chicago. Oh, the women in New Orleans are beautiful, you know. And I tell you, I worked in the student health center, and every time these young ladies, I would ask the question. No, they're not sexually active here. My boyfriend's in Chicago. They go home for a break. Guess what? He wasn't as devoted to you. He didn't keep that vow of abstinence. And when she came back, and it's just because I remember she was so emphatic about her relationship. And she came back, she had trichomonas and chlamydia. You know, so a lot of times they'll go home for Thanksgiving, Christmas break, come back with an infection because the guys didn't quite do the same thing. You guys have any other questions? Anything in the world that you want to ask? I didn't pick the topic. I wanted to talk about sex. Because everybody's interested in sex. But I mean in terms of gender and other things. But y'all are so knowledgeable. The other thing would trigger me when you said experimenting. So when I grew up, there wasn't as open a discussion about sexual being gender fluid. And you guys are more open-minded with regards to that. I find it's much, you do it so much more easily, switching pronouns when somebody says, I identify as they, them. It's easier for you guys to make the adaptation. You're kind of growing up with it. For other people, for older people, so be patient. Be patient. But that's part of it. They have that freedom, you know, they have more exposure to everything than what we did. That internet is something else. So I thank you for inviting me. I'm sorry I went over. I know y'all have questions. I know somebody wants to ask something, a burning question. If it's burning, it ain't good.
No question. So how can our audience, if there are follow-up questions, can they visit you at the clinic? Can they make an appointment? What ways of following up if there are questions?
You can email me because I don't practice clinical medicine anymore. I've been forced to retire. I do something else now. I said I was reinventing myself. And that part is true. I have a different job now. I work from home. It's still in medicine, but I'm using my undergraduate degree in pharmacy and my general medicine degree. So I do insurance approvals for very expensive specialty medicines. Yeah.
Is there a specific email address?
JennyLap@AOL.com. That's the easiest one. JenniLap. Jenny Lap for Jennifer Lapeyrolerie. Nobody wrote it down, so they're not gonna. They fast? Yes, they are. Yeah, I forget about the electronic.
Right, so the information will also be presented on our Memorial Library website, and I believe that our videographer will also include it as part of the presentation. I want to thank Dr. Lapeyrolerie for your round of applause. Thank you for giving us an important opportunity to see an intergenerational conversation taking place and delivery of information, because that's what it is. It's a no-brainer, right? We need to do next year, or 2 years from now, is actually create an environment where we can have our grandmothers, mothers, and daughters in the room and talking about the importance of intergenerational communication. I would be.
Yeah. I mean, that's a
There was what's going on in those assisted living facilities. They have not just surges of COVID, I'll just say that.
Yeah, exactly, right.
Humans are sexual beings. That doesn't, it may decline as testosterone goes down, but it doesn't go away. And for women, once they know they can't get pregnant, sometimes they're extremely liberated. Like, that's off the table. So you familiar with assisted living or senior living? Nah, most people think old folks home, they're infirm. These are people that are independent, who own their own little spot, and they creep. So it's not just for you Oh, the stuff about sexuality, maybe next time.
Yeah, so maybe next time. Because that is an area where I think intergenerationally
So maybe
becomes
next time.
more challenging to have a conversation. The pronouns, all of these are important for us to be mindful of. We don't necessarily have to agree on intergenerational, but we at least just have conversations with each other. Thank you so much to Dr. Lapeyrolerie. Thank you to all of the audience for your participation today. Thank you again to our sponsors, United Way of Southeast Louisiana, Tulane University, Dr. Martin Luther King Charter, Newcomb College Institute. Thank you again to Dr. Moore, Mr. Martin. You want to say it, Mr. Martin? Mr. Martin, walking around here. Thank you to all of our tech supporters and again to the ladies who prepared the meals for us today. Again, thank you for your participation, and before you exit, please make sure that you have completed those evaluations and have provided, have transferred them to one of the Tulane students who will then be able to get those back to us. Y'all have a great rest of the afternoon.